Therapeutic nurse-client relationship. So the objective that we're going to do today is identify the goals of that relationship, state principles, identify interventions, identify therapeutic communication techniques, and then evaluate therapeutic impasses and identify those interventions that we can use to deal with them. When it comes to the nurse-client relationship, it has to be a mutual learning experience based on the humanity of the nurse and also the patient. There has to be mutual respect and acceptance of social cultural differences. There must be use by the nurse of personal attributes and clinical techniques to kind of bring some insight and towards that change in behavior. Personal qualities of a nurse require first that self-awareness be done. They have to listen to themselves, allow themselves to have genuine emotions and experience them, identify and accept their own personal needs, move their body joyfully and freely, and explore their own personal thoughts and feelings along with their memories and impulses. Self-awareness is about listening to and learning from others through active listening and openness to feedback, but also self-disclosing and revealing that part of themselves that show of a good personal health and achieving a healthy personality. Value clarification starts with asking ourselves what is important to us. We have to make sure that when we're engaging in that question, it helps us to be honest and accept differences in others. We avoid using patients for personal satisfaction or security. We identify sources of dissatisfaction and clarify and prevent them from interfering with that nurse-client relationship. And then understand that there are going to be challenges as there are things that include diversity that can impede or cause an impasse in that relationship. Think about the personal qualities of the nurse. With value clarification, an individual chooses freely from alternatives after thoughtful consideration of the consequences of each of those alternatives. With prizing, there's a cherishing that happens because we're happy with the choice that we made and willing to affirm that choice publicly, and then we act on that, repeatedly doing something with the choice that we've made for ourselves within our lives. When we think about the phases of the nurse-client relationship, the pre-interaction phase is that place where self-exploration happens, where we deal with stress and challenges, and misconceptions and prejudices as well. This is something that not only everyone should do, but also you as a student, especially as you're going into your clinical experience. In the introductory or orientation phase, why did the patient seek out help? Was it voluntary or involuntary? What's the parameters of the relationship? That's when that phase happens. That's what happens in this phase. This is where you establish a contract with them, and you also let them know that you're going to be confidential with their information, and then you make them aware of when this relationship is going to terminate, whether it be at the end of your shift or upon their discharge. In the working relationship, this is where you maintain the relationship. You're gathering data at this particular point because that is what happens in the working phase of the relationship. You're going to explore stressors and promote insight, and then you're going to look at the change in the patient's behavior, and you're going to see that happen within this phase. The termination phase is the review of that progress made during the treatment and attainment of those specific goals and an establishment of the reality of that separation. Therapeutic impasses block the progress of the relationship between the client and the patient. Intense feelings both between the patient and the nurse can create resistance, transference, countertransference, and boundary violations. Resistance is when the individual is reluctant or avoidance of troubling aspects of their own self, unwilling to change, and this all happens within that working phase of the relationship. It's possible that the nurse may be an inappropriate role model for that therapeutic behavior. With transference, it's an unconscious response that happens, that the patient experiences attitudes and feelings towards a nurse that are really associated with some other significant figure within their life, whether it be facial features, manner of speech, personality styles. The patient attempts to reduce their anxiety using transference, and sometimes it creates inappropriate intensities of the patient's response. With overcoming that resistance and transference, it's important that we help the patient gain awareness of their motivations, help them learn to be responsible for their actions and their behaviors. And then we have to use listening, help them clarify and reflect on their feelings that they're expressing, and explore the behavior and possible reasons for these things occurring based on the nurse's knowledge base. With countertransference, transference applied to the nurse can have the countertransference response, in which there's an inappropriate emotional response to the patient not justified by the reality. Examples of this can be reactions of intense love or caring, disgust or hostility, or intense anxiety in response to resistance by that patient to want to make changes. And as a result, problems or difficulty can result with the patient. Boundary violations is when the nurse goes outside of their boundaries, of that relationship, and becomes social, or providing economic solution, or develops a personal relationship with the patient, receiving feedback that the behavior that they have is intrusive. They have difficulty setting limits. They relate to a patient like a friend or a family member. They may even have sexual feelings towards a patient, or feels that they are the only ones who understand the patient and can be able to help them. With boundary violations, there are so many things that play a role, whether it be role or time boundaries, place and space, money, gifts and services, clothing, self-disclosure, language, post-discharge, social boundaries, intimacy, and sexual boundaries. All of these have an impact on that nurse-client relationship that allows us to actually improve the patient's behavior. We have to build rapport, and that's about establishing that trusting environment so that they feel comfortable sharing information, making sure that it's warm and caring, making sure they're giving good eye contact and using a clear, firm voice, being quiet, or creating a quiet, comfortable environment, and then making sure to keep their communication simple and clear based on what that educational development level may be of the patient. We want to get to know them using broad opening statements like, tell me a little bit about what brought you here to the hospital, or I'd like to get an idea about what your ideas and concerns are. When we're building that trust, that's the foundation of all the relationships that we're going to have, no matter where we establish them or with who. It shows that we're concerned and that we care and that we're willing to create a safe environment. How do we promote that trust? One, we have to convey respect. We have to show warmth and caring. We have to use the client's proper name or the name that they prefer to be called by, if it's proper. Using active listening, give sufficient time for them to answer questions, maintain their confidentiality along with appropriate eye contact, even smiling, being honest and open, give complete information, provide consistency, plan schedules, follow through on commitments, set limits, control distractions, and making sure that we're using our body posture correctly. That includes our arms, our legs, making sure that it's relaxed and not crossed, and leaning slightly forward to show that we are concerned about what they have to share. Respect includes that ability to view the other person as being worthy of the care that we're going to give them. Also allows for them to see the potential of their own strengths and ability to have, or the achievements that they've already had. So we ask the client, what do they prefer to be called, and avoid minimizing what they want to talk about in their concerns. Genuineness is about the ability to meet person to person in that relationship. You don't hide behind the role of the nurse. You don't listen to others without distorting their messages. You're going to be clear and concrete in communicating and using that therapeutic communication skills. Empathy is always the ability to be sensitive to and communicate an understanding of their client's feelings. Not because of a shared experience, just the feeling itself. Perceiving and understanding it accurately as well. It feels emotions as the client feels, but holds on to objectivity. So it is always, when you're using empathy, you repeating back to the patient what you perceive they are expressing as their emotions, and you do it in a way that you're if being definite if you've heard them say that this is the emotion that they have, or clarifying if you're not sure of the emotion, if you're perceiving it accurately. But it will always be you repeating back to them what their emotions are, making sure that you in that relationship always using empathy.